Okay, pet owners, so many of you have wanted me to cover hip dysplasia for quite some time now, so let's finally give you guys a basic overview of a condition that affects both dogs and cats. Okay, so now to kick things off, you get it? Kick things off because we're talking about the hip. We first need to go over the hip joint itself, which is something that some people will refer to as a ball and socket joint. Now, the ball portion of the ball and socket joint is a part of the femur called the head of the femur, and the femur is obviously our thigh bone. And the socket portion of the ball and socket joint is a part of the pelvis called the acetabulum. Normally, the head of the femur fits very snug inside of the acetabulum, which is kind of in the shape of a cup, and there's a lot of different forces that keep these two things together. Kind of like Noah and Allie in The Notebook. I bet you weren't expecting that Notebook reference there, were you? Anyway, getting away from all that gushy romantic stuff, what happens with hip dysplasia is the head of the femur doesn't fit as snug in the acetabulum and the joint itself becomes loose, or it develops laxity, as we like to say in the nerdy scientific community. And when the hip joint develops laxity, what happens is the head of the femur starts to bounce around on the inside of the acetabulum, or it just straight up pops in and out. And when that happens, it leads to a lot of damage of the hip joint, which creates a lot of bony changes that are kind of similar to arthritis, and this will eventually lead to degenerative joint disease of the hip. And to help you visualize this, I have two x-rays down below. On my right is an x-ray of a normal hip, and you can see how well the head of the femur fits into the acetabulum. On my left is a hip with degenerative joint disease. All of those bony changes and the fact that the head of the femur doesn't quite fit into the acetabulum is what leads to the joint not functioning appropriately and can also lead to a lot of discomfort. Hip dysplasia is considered a genetic disorder and happens in puppies and kittens when they're very young and gets worse as they age. And we don't fully understand all of the things that lead to hip dysplasia, but there are a lot of theories out there. Even though this is considered a genetic condition, there are some things in the environment that can contribute to the development of hip dysplasia. Things like growing too fast or being overfed, different types and amounts of activity, things like that. When it comes to diagnosing this condition, we rely heavily on exam findings and changes to x-rays, and there are a few different and very specific ways we take x-rays to diagnose this condition. And because hip dysplasia is an orthopedic condition, all of the clinical signs are typically going to center around the pet limping. The list of breeds that's predisposed to this condition is far too long for me to put in a video, so if you have any questions about a specific breed, Dr. Google can probably help you out. And when it comes to treating this condition, we typically start with conservative management like activity restriction and medications that help control discomfort and inflammation, but when that doesn't work, there are a couple of different surgical procedures that we can pursue if we want to.